Hello, I'm Dr. Lorena Shih, and I'm one of the pediatricians actually in the Redmond office, and I love talking about newborns. So I'm thrilled that you all are here today, so that we can spend a short time talking about newborns. I could go on and on, but I know we have a shorter time today. So first off, I have just a few basic, basic things to talk about in terms of what to expect from this talk. Is that for the sake of this talk, I'm talking about newborns 0 to 2 months of age, and realizing that every baby is unique. There may be discussion points in my talk that don't apply to your baby or your expected baby, but talk to your pediatrician about any individual needs, just as Hannah had mentioned. The role of a pediatrician is really to partner with you all as a family, to help you achieve parenting success. So today's goal is really to give you some sound advice based on science when it's available, but really just to share my experiences as well with newborns. And I have a couple of poll questions just to get started, so I know who's in the audience. So the first poll question is just, how old is your baby? And I'll give you a couple seconds. Yay, so wonderful. So we have a few people who are have not yet expected. And the second one, of course, you're breastfeeding or planning on breastfeeding. Wonderful. Okay, I'm gonna close. Thank you. That's helpful. So first of all, and for those of you who have more than 3-month-old babies, this will be a little bit of a review, but I just wanted to share how different newborns look when they're born. I mean, they come out and you're like, whoa, this is not what I expected necessarily. So they have a different look. Their skin's a little wrinkled and pink, and they're peeling often. Newborn rashes are super common. I have a little slide to show you that. And when they come out, due to that delivery process, their heads are sort of molded, or sometimes they're flattened. Their legs and arms are really super flexed, and they have breast buds, and their genitalia are sort of reddish, and girls even have early on will have vaginal discharge and even a pseudo period for baby girls. Lanugo, which is that fine baby hair that's on the skin and on the scalp, that hair falls out generally around 3 months of age. And so those of you who have more than 3 months of age babies, if you're seeing lots of hair coming out, that is totally normal. And they also make different noises. So normal newborn noises, lots of snorting, sneezing, hiccuping, grunting, those are normal newborn noises. And they also make kind of jerky, twitchy movements, and that's because their nervous systems and their nerve fibers are immature. Newborns also have periodic breathing, which is quite scary to parents. So in the initial, they can breathe fast, 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 and then pause for like 10 seconds, and then fast, 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 and pause. And that breathing pattern is actually super normal for babies and newborns. So newborn rashes, again, common newborn rashes. I just chose a little sampling of it. Erythema toxicum, baby acne, here with the cheeks, lovely cheeks, cradle cap, and cradle cap on or seborrheic dermatitis on the skin. So these are all normal newborn rashes. I wanted to share some just highlights about newborn development. Is that babies are born with senses intact: smell, touch, hearing, vision. At 1 month, they look, and it's pretty immature, but these senses are intact. At 1 month, they're looking at your face, they're smiling, maybe a little bit randomly still, and they certainly are starting to have more distinguished crying. So you might hear a hunger cry versus a sleep cry versus a distress cry. And then at 2 months, you're starting to get that social smile, that cooing. They're tracking you with their eyes, so they're following you. They're holding their head up, and they definitely respond to calming and soothing gestures. Nurturing your baby and fostering newborn development is all about learning and responding to baby cues. And these are sleep, hunger, satiety, interest cues and overstimulation cues. And so they'll give you those cues. I really tell parents, this is the time to like be with your baby. Don't worry about training them or needing toys. Just being with your baby and responding to your baby's cues helps with development. Try to put away those screens. I know that's part of our lives, but but the goal is try to put away the screens as well. Okay, newborn norms. So at 2 weeks of age, they're sleeping long stretches of sleep. I'm not going to go through everything on this because I know that this may not apply to everybody, and you may forget as well. But this will be available to you on the PowerPoint that comes through. So 2 weeks of age, they're sleeping long hours. 6 weeks and 2 to 3 months, those hours decrease. Feeding is frequent at 2 weeks, becomes a little bit less frequent closer to 2 or 3 months. And you can see the stools and wet diapers and the crying. And we'll go over these, we'll go over sleep, feeding, and crying in a little bit more detail. So let's talk a little bit about newborn feeding. So newborns lose weight. They lose about 10% of their birth weight in the first several days of life, and then they regain their birth weight by 2 weeks. And this is nature's way. Newborns are born with extra brown fat, and moms who are breastfeeding initially are breastfeeding produce colostrum, which is a super high protein pre-milk that babies feed on, and then as milk comes in, they start to regain that weight. So weight gain is pretty rapid after 2 weeks, about 5 to 7 ounces every week until about 3 months of age. So that if you do the math, it's about you're doubling your birth weight by 6 months. And again, feeding is super frequent in the beginning, so 8 to 10 times a day, that's a norm. It may be 12 to 14 times a day, and that's still considered normal. One common question I get is, how do I know if my baby is getting enough breastfeeding? And I tell, this is a learned experience, but I tell parents to watch babies, not the clock, but watch babies and their cues. So hunger cues, rooting, they're opening and closing their mouth, or maybe sucking on their fist, or fussing is actually a little bit, crying is actually a little bit more of a later response to hunger. And those satiety cues, when they are satisfied at the breast, their body's relaxed, they're drifting off to sleep, they're coming off the breast, or they're stopping sucking. Now, in the beginning, some of those cues are really hard to distinguish because babies are pretty sleepy at baseline. But some physical signs that they're getting enough: wet diapers, they have moist mouths, and then of course they're gaining weight appropriately, which is our job to watch. Okay. But let's talk a little bit about breastfeeding versus formula feeding. I'm so glad that most of you all are it sounds like are planning on breastfeeding or are already breastfeeding, which is wonderful. Recommended to decrease risks of infections with babies because the antibodies transfer. So even if moms are sick, that's the time to breastfeed because their antibodies are protecting babies. From the antibodies that they are responding to with that infection, they're passing through the babies through breastfeeding. There is a lot of evidence that it helps with gut function and digestion. So breast milk matches what babies need, what babies can process best. And then there is evidence that it can decrease a risk of sudden infant death syndrome or sudden unexpected infant deaths. And decrease the risk of even type 1 diabetes, inflammatory bowel disease, and some wheezing, which is asthma. And there are some studies that have shown that it can actually improve neurodevelopment as well. There are plenty of medical reasons to formula feed, and I won't get into all of them, but generally, prematurity, low birth weight, mom and baby reasons for sure to formula feed. But certainly breastfeeding, we will support you 100% in trying to breastfeed for that first year of life. Okay, so how do you optimize breastfeeding? It's all about milk supply, keeping up the milk supply, and working and practicing transfer of the milk at the breast. So there are many hormones that sort of a complex system of hormones that help with both milk supply and breastfeeding. So prolactin, which helps with production, oxytocin, which is that letdown hormone. Cortisol is a stress hormone that actually can delay milk supply. So if you've had a particularly stressful delivery for reasons that are out of your hands, of course, cortisol levels can be elevated, and that can delay production, and we know that. So frequent stimulating and emptying is important because it's a supply and demand system. So frequent stimulation of the breast and then emptying the breast after every 3 to 4 hours is important to help keep up supply. And then parents ask about breastfeeding versus a pump. I think the bottom answer, or the answer for this, is really that it depends on on the situation, but breastfeeding can be equal to the pump depending on the situation. So the stimulation depends on whether moms stimulate better with breastfeeding versus the pump, and then the transfer part certainly depends on how good that latch is in the transfer. So it's all about practice, practice, practice. And I say help anyone you can ask about who's breastfed. Please ask them for help. Definitely use your partners, because sometimes it's a 2-person job to get babies latched. Ask all the lactation specialists and doulas out there that you can access. Ask us, please, because I think it does take a lot of practice. And I will say that, just even personally speaking, I think breastfeeding is one of the hardest things that you can do as a parent. I'm just, I think I'm going to skip over the bottle feeding part just in the interest of time, so that I can get to some other things. But I think it is important to know that bottle feeding, can be really a good way for partners to help too. And so generally at about a month of age, I try to add that bottle in, if you want that independence from from only doing breastfeeding. So common feeding questions. Again, we just talked a little bit about the bottle and pacifier use. I say generally around 3 or 4 weeks once feeding is established. Tongue tie and lip tie is an increasingly common diagnosis right now, and lactation specialists and us are more aware of this as a diagnosis, and there are a lot of questions about how much and how far to go with tongue ties and lip ties. And so I would encourage you all, if this is an issue, to talk to your pediatrician about the risk benefits. Okay. And then newborn reflux, spitting up, super common. Our stomachs stomachs are only yay big, and sometimes what's coming in is this much. And so it's going to be a little bit of a pop-off valve and so it's common for babies to spit up. Okay. Let's talk a little bit about sleep. So sleeping like a baby, newborn sleep, lots of it, right? It's based on a 24-hour cycle. So there's a lot of day-night confusion. It's not convenient. There's very little regularity in the beginning. A common sleep cycle in the beginning is about 1 hour, but the range can really vary from 30 to 70 minutes. And newborns spend a lot of their time in REM sleep, which is active sleep. That's like they're kicking and moving around and having fun night, kind of dreams and bicycling their legs in their sleep. And that's active sleep when their brains are developing. And newborns spend 50% of their time in active REM sleep. So when they're sleeping, it may look like they're actually not sleeping, and versus non-REM sleep, which is that really quiet sleep. REM sleep generally is at the beginning of the sleep cycle. So they may be actually asleep when they're making all these noises and bicycling around. Okay. All right. So safe sleep. You've probably have all heard alone, bear, in a crib. So ABCs of safe sleep should be a firm mattress, and while co-rooming is recommended, bed sharing and co-sleeping is not recommended as the safest position for sleep. Also, additionally, side lying, tummy sleeping, pillows, blankets, sleep positioners, sofas, having hats on, twins sleeping together in the same crib, still not recommended or advised. Okay. Can I teach my baby to fall asleep? Critical question. And yes, you can teach your newborn to fall asleep. You can build a routine around them, even though their cycle is so irregular. You can follow drowsy signs and help them soothe them into sleep. And so drowsy signs generally appear within an hour or so of being awake, 1 to 2 hours. So it's, their eyes are drooping a little bit. They're slowing down a little bit. And at that point, it's time to actually soothe them to sleep. It's okay to natural and helpful to help babies, newborns fall asleep. So snuggling, massage, rocking, swaddling or sleeping, singing to them, or white noise. Partners can absolutely help. Soothing to sleep is natural and not spoiling your baby. Okay. So I think it's okay to help babies soothe to sleep. And babies often need help to soothe to sleep. Sleep does mature around 6 weeks of age when the melatonin, when their natural melatonin production kicks in. And so that's when you get a little bit longer nighttime sleep. 4 to 5 hours is sort of the longest stretch I'd expect around 6 weeks of age. And self-soothing, learning to sleep on their own independently, develops usually after 2 months of age. That's for nighttime sleep. Daytime sleep, it doesn't really organize until 3 or 4 months of age. So those nice nap times, expected nap times, that won't organize until closer to about 3 or 4 months of age. Okay. So newborn crying. Why do babies fuss or cry? They communicate needs. It's normal for babies to fuss or cry, and this really peaks around 6 weeks of age. I think babies also, when they feel gas, there also is a little bit of discomfort and crying potentially. But gas is a normal function and reflex after feeding. And so, I want to make sure that people understand that it's not an abnormality for babies to produce gas. It's totally normal, and it happens as a reflex after feeding. There is this purple period of purple crying, which happens around 6 to 8 weeks of age, right? So unexpected, it's peak. Unexpected crying can come and go, resists soothing. There's a pain-like face, and then it's long lasting. It could be even 3 to 5 hours a day. So the evening hours are sort of the witching hours. I always think about that as sort of that time period when kids or babies or newborns are at the toughest time. I want to mention that the word period means that the crying has a beginning and an end, because that peak does mean that there is an end. Okay. And usually by around 10 or 12 weeks, babies do settle in. Soothing strategies. Again, soothing is not spoiling. So holding them, swallowing them, rhythmic motion, like, kind of gentle rocking, sucking on a pacifier, pacifying at the breast, white noise. Those are all super helpful things. And partners can absolutely help. There are babies who have extreme fussiness. And if you have one of those babies, I encourage you to talk to your pediatrician, because this can be hard for anyone. About a fifth of babies, have really more extreme fussiness or colic. There's a rule of threes to define colic: 3 hours of crying per day, more than 3 days a week, lasts more than 3 weeks. We don't know why this happens. Their exam and growth are normal, and these babies are hard to read, really. And so it requires a lot of support for both families and babies. So we know that it's super helpful for parents to get support. Sometimes there can be some feeding changes and soothing strategies that we recommend. There are other unproven interventions that we may talk about as well. I would encourage you to talk to your pediatrician. Okay. last set of slides, I think, that we're going to be able to cover is really taking care of you. I think baby blues are common, and I want to make sure that parents understand that this is a drastic, big journey that you're on that changes everything about your life. So sleep when you sleep, when your baby sleeps, I think is important. Try to get outside when you can. I know there's certain cultures where that isn't encouraged, but if you can, get outside with your baby, be with your baby. Don't feel like you have to do things. And please allow partners, family to help. Give up that control to allow your partners and family to help. Postpartum depression, I think, is common, and I wanted to mention that some of the signs and how frequent it is. And again, please bring, if you recognize some of those signs, get help. We want to hear about it. We generally at 0 to 6 months of age, you'll get a small questionnaire called a PHQ-2 for moms. This allows us to recognize soon as well if there's struggles. Okay, and we have partners that we work with who can absolutely help. Okay, I have a few minutes to just cover my last set of slides, which really is just to tell you, I think those of you who have more than 3-month-olds know this, but those who don't, I want to share with you the what, when, and where. So Allegro Pediatrics has been on the East Side for more than 50 years, and we have 7 clinics all on the East Side, and now over 80 pediatric providers. We are open every day of the year, including New Year's, Christmas, major holidays. We always have a nurse and a doctor on call for us as well. And we do have telehealth visits available every day as well. I think when you first have baby, you meet multiple people, but choosing a primary care provider is encouraged. If you find a pediatrician or a provider that really you seem to gel well with, choose that person as a primary provider, and try to schedule your checkups with that provider so that you can have that continuity of the care, right? What to expect in clinic, in-person visits, we do our checkups, we do vaccines with our checkups. We also have, of course, sick visits, and we have X-ray and lab facilities to be able to handle those sick visits. We offer behavioral health care. We have a team of doctors that also sees patients in the hospital if should they ever need hospital care. And this is at Seattle Children's Hospital. So how to contact us? I mean, you can make appointments online. You can call any Allegro clinic, register for the portal, so you can email non-urgent questions at any hour. And then, of course, we always have nurse advice with doctor backup 24/7. Okay. This is the Well Child Check vaccination schedule, which is actually on our website as well. And I just put it up there so that you can see it and visualize it. Lastly, I just wanted to thank you for attending. I so appreciate you all for your interest. And I wanted to share one photo of my kids, because I didn't even tell you that, is that I have twins who are now 16. And I will leave it at that and try to answer any questions.
All right. Thank you so much, Dr. Shih. We've got, you can use the Q&A button at the bottom of your screen. We have a few minutes for some questions. So our first question here is, what are the signs of tongue and lip ties?
Good question. So I can dive a little bit deeper on that. So we do have a little time. So tongue tie. So first of all, I should mention that lip tie is not something that generally we encourage people to act on from a surgical standpoint, because lip tie just means that there's the frenulum between your lip and your gums is a little bit shorter or tighter. But this is versus tongue tie, which is the frenulum underneath the tongue is a little bit tighter and may restrict tongue movement. So the general principles about these ties are that it can affect feeding and latch, specifically with with breastfeeding. And so if the tongue movement is restricted enough where the latch is difficult, or baby's not able to get their tongue out far enough to really establish a good suck, then sometimes we will recommend doing a tongue clipping. We do not recommend tongue clipping for any reason as a newborn, except for that, is really that feeding. So there's really no medical evidence to suggest that tongue clipping as a newborn can impact speech or anything like that later on. So the lip tie, specifically, we do not recommend any surgical intervention, because our dental colleagues at Seattle Children's Hospital have seen, and this is based on their recommendations, is that they have seen some really troubling cosmetic defects later on from having lip ties clipped as newborns. And so we do not encourage that as a newborn. Lots of other questions. So precautions about COVID. So thankfully in our area, most people are immunized, or I would say a good majority of our patients and families are immunized. But the precautions that we talk about with COVID are really the same for any other viral illnesses, like RSV or adenovirus or other viruses that circulate. Flu virus is that if there is a vaccine available, then we encourage vaccination, because cocooning around baby, so having everybody vaccinated around baby, helps babies, right? But the precautions for colds and flus and COVID, adenovirus, influenza, RSV are really the same. So vaccination, hand washing, keeping sick kids and family members who are sick away from newborn babies, if you as much as you can. The biggest thing is hand washing. Okay. Ooh, did I answer that question? Okay. All right. So
yeah, since we're running out of time, we can kind of combine the last two here. So if we could do temperature for sleep, and how long you should swaddle your baby, or how to dress them.
68 to 70, not too high. 65 to 70, I would say. What age should you swaddle a baby? When they are getting ready to turn to rock or to roll, around 3 to 4 months.